Hi, I'm Jen Langford. I'm the development lead for the Central region at Dementia UK, and I'm joined today by Paul Edwards, who is our Director of Clinical Services. So we're here to find out a bit about what's going on in the dementia care field at the moment, and I've got a few questions that I'd like to ask you, Paul.
Sure,
So
go ahead.
firstly, sorry, I'm interrupting you already.
Go for it.
How do you think the pandemic has affected care for people with dementia and their families?
Yeah, it's a good question, and I don't think we're at the end of it, despite everybody hoping and wishing that we were at the end of the pandemic. Um, I think it's been hugely devastating for people with dementia and their families, if I'm honest. We've seen loads of things disappear out of community support that were once there that aren't there anymore, and they're taking a long time to come back. That puts pressure on people living at home and carers who are caring for people with dementia at home, because those normal um, support services aren't really back to normal yet. So that means that people can feel still quite isolated in their own homes, and carers can feel the additional burden of not having respite and support like they used to. So that's one thing that's been affected. I also think we've throughout the pandemic we have had major delays with our diagnostics, and so we have thousands and thousands of people at the moment in the system, or not even in the system, waiting to get a diagnosis, and those diagnostic services are taking a while to come back as well. And it's really difficult if you're in that state, knowing that something's not right, waiting for a referral, waiting for an assessment, because until you get that assessment and the diagnosis, then a lot of the help and support won't happen. So it's only after diagnosis that you get additional support, social services referrals, etc., very often for people with dementia and their families. So it's a time of immense stress. I think the other thing we've seen throughout the pandemic, and still a little bit now, is people have really struggled to see people, and particularly in our care homes. So you'll know, care homes have been really badly hit during the pandemic. They've had a lot of pressure on them. We've seen a lot of, sadly, a lot of mortality within care homes, and we've also seen that really destructive effect when families haven't been able to visit the people they love in care homes. So that's had a really devastating effect on people with dementia, because obviously contact and having usual people around you and people coming to see you in a care home is really important. But also for families have felt really isolated, a big sense of loss, and all the rest of it. So I think, I suppose I've been describing it as we're still in dementia care, we're still dealing with like COVID's long tail, and it's really long, and all of these effects of COVID are still playing out in our society now. And and truthfully, I don't know when we're going to get back uh, to usual levels, even though they were very patchy and not very good in some areas. I don't know when we're going to get back to usual levels of service yet, and that means that lots of people are contacting us, right? People are, calls to our helpline. People are more distressed, more upset, more stressed because of those usual services not being around.
I think we're definitely seeing in the development side issues around diagnosis rates, and that is having a big impact
Yeah.
on new services and what the needs and gaps are in each area. Um, what do you think are those kind of key issues for admiral nurses, I guess, as well, around supporting families and people with dementia?
I think, I talk to, like you do, Jen, I talk to admiral nurses a lot. And the one thing that is coming through really loud and clear at the moment is just the increased levels of complexity that they're having to deal with. People are not getting the services they need. People are ending up in a lot more crisis situations than they were before. And admiral nurses are caseloads are like going through the roof, because there's not enough services around to try and provide the support to maintain people in the place and the way they want to be maintained. So I think that's the first thing, is this increase in clinical complexity that we're seeing. I think the second thing I'm noticing, not just in admiral nursing but across the nursing workforce, is people are really tired. People have been, trying to cope with these immense challenges for quite a long time. And when I talk to our admiral nurses, some of them are they're all amazing, obviously, but some of them are really worn out and tired just because of the amount of pressure that is falling onto their caseloads with the complexity. I think they're also expressing their views about how difficult the systems are at the moment. We've got these changing systems around structures of health and social care, and trying to find out what was once there, where it's gone, and who to refer to, and all that stuff as we move into more integrated care. I think that system change is also causing a lot of uncertainty for admiral nurses and actually people with dementia and their families and lots of other health and social care professionals.
Yeah, there's definitely a lot around system change, isn't there? And yeah, I'm seeing that. And I think some areas are particularly thriving from that, but others are finding it increasingly challenging, and there's quite a lot of difference across the country. So in terms of what's happening at a national level with regards to policy and sort of government terms in relation to dementia, what can you tell us about that?
Yeah, well, I think a few things have been going on really. So we've been waiting for the new national dementia strategy. Every few years we have a new strategy which focuses on particular things, whether that's diagnostic rates, research, support, care, all that sort of thing, raising awareness, changing perceptions. And we've been waiting for the latest version of the strategy for quite a while now. So so we hope that the next national dementia strategy will be out in the next few months, and that will set a course of change. And it really needs to focus on a few things. I think the first thing it needs to think of is what we're going to do about post-diagnostic support. Okay, it's great having people diagnosed, and we need to definitely increase the rates of diagnosis, but so what? What do we do after that? What is the mechanism around families and people with dementia to ensure that they can live as well as they can in the place they choose for as long as they can, and try and reduce all of the crises and the complexities that are going on because the system isn't working for them. So that's one of the things we hope to see. Obviously, we want to see more money go into research, and there has been some work around by other colleagues in the dementia field looking at the kind of funding needs for research, where we need to go, the kind of areas that we want to research in. So we're hoping that the next strategy brings or says something about that will be useful. I think more broadly though, I think we are falling down the agenda in policy terms. Dementia care seems to go up and down on the agenda politically and in policy terms. That doesn't mean that people don't care about it. People really do care about it. But in terms of priorities, I get a sense that it might be slipping down those priorities a bit more. And actually, we need to keep it at the top priority for health and social care because it's such a big issue. So I'm noticing a bit of that. I see a lot of work going on at the moment around the workforce. You've probably seen that as well in terms of plans for the NHS workforce and plans for the social care workforce. Certainly I've been involved in quite a few of those discussions, and a lot of those plans aren't there yet, so they're not finalised, and some of them are maybe just focusing on training rather than looking at the much bigger issues that we've got, such as recruitment and retention of staff in health and social care, not least in nursing, but across the board in health and social care. So I think that is genuinely concerning. I'm seeing a lot of talk, a lot of activity. I've been involved in a lot of conversations about workforce plans and workforce planning. And there has been some monies, some new monies, as you know, from the government for COVID recovery for the NHS and also to support social care going forwards. We're not sure that's the total answer, but it is a step forward in terms of applying some additional funding. We're not sure how much funding, for example, from the billions that are announced will actually make a difference to people with dementia and their families, because they're not at the front of the queue again. So because of all that kind of policy sort of gaps that we've got at the moment when it comes to dementia and the lack of a national dementia strategy. So the future is a bit uncertain in policy terms, I think, at the moment. I'm hopeful though, as ever in this field. I'm hoping that the new dementia strategy will really help focus what we need to do over the next few years.
So do you think the new dementia strategy will sort of have things that will actually make a difference? Or is that being a bit too hopeful?
Well, we always have to have hope in dementia care, Jen. I think, and I am, as you probably know, quite an optimist around these things. But I don't think the previous dementia strategies have made enough of a difference. And aspirations of 65% diagnostic rates. Really, what happens to the other 25, 35%? So I don't think it's made enough of a difference. This one has to, because post-COVID and all of the challenges we've got, the tens of thousands of people waiting for support and diagnosis, if it doesn't alter that, then we're going to be in heaps of problems. And actually for us at Dementia UK, that means we'll be supporting more people, having more crises, dealing with more complexities. And some of those stories are heartbreaking. Behind this big political conversation about dementia are human beings that are having really rubbish times sometimes.
So you mentioned that dementia seems to fall down kind of priorities sort of at a national level. Is there anything that Dementia UK or, even us as individuals can do to make a difference to that? What do you think would need to happen?
I think there are things we can do at a very local level. So, we're moving to much more integrated approach across health and social care. We need to influence those conversations, whether it's commissioning conversations, whether it's practice to practice conversations, whether it's raising awareness amongst GPs or other primary care colleagues about the value of getting really good care and support for people with dementia really early on. Those kind of things we can do at a very practical or local level. We can also, I guess, work on a more national level as we do, trying to do kind of more regional or national influencing to make sure that within commissioning structures there are specialist nurses, for example, admiral nurses within those commissioning structures, so that at least families get the help and support they need. I think what we're doing though as a charity is we've set up we sort of set out a 10-year plan to radically change dementia care. Now 10 years is a long time, right? So, and we need change right now, but I guess that plan focuses on three main issues. The one is we are calling for structural change. The structure and system around people with dementia and their families isn't working, because people with dementia and their families fall through the gaps between health and social care too often, or they get moved from mental health into social care and then back to the GP and then somewhere else and somewhere else and somewhere else. And so if you talk to family carers, as I do, they say they have to tell their story 10, 15 times every time that there's a new person or a new spoke to talk to there within the system, and that's not working. It's simply not working for people. So we definitely need a system change, and that's got to be really radical. So that's one of the things we've been setting out. Second thing is, I think we're building up problems in different areas in dementia care. So one of the things we're calling for is a much more inclusive approach to dementia care. So, for example, whether you're excluded because of a particular diagnostic reason. So I was talking to somebody the other month who needed a care home place, and they were diagnosed with Lewy body dementia. And when I was talking to their carers, they were saying they couldn't get a care home place because they didn't take people with Lewy body dementia, regardless of how the person was. So being excluded because of your diagnosis or your culture or your faith or your your lifestyle, we need to really focus on how we build a more inclusive system for people with dementia. And I think one of those really key areas is young onset dementia. Services have been falling away for people with young onset dementia, so people diagnosed under the age of 65 for years, and it's really hard to get services for people with young onset dementia. So we want to do things over the next few years to change that, so that we build a more inclusive approach to dementia care. And the one other area, I guess, that we want to continue to work on is to change the societal perception of dementia and what it means to live with dementia and live well with dementia, and what it means to support people with dementia if you're a family carer or a loved one, because I don't think those things are understood. I don't think we have really got to grips with tackling the stigma of ageism, dementiaism, all those things that play a part in how people with dementia and families experience the care they get. And that's another area for us to really focus on. And we'll be shouting that really loudly to anybody that wants to listen, and we'll be working with our partners in lots of different organisations to bring about a change and try and influence policy over the next few years.
It is sad, isn't it, that there's still so much lack of understanding around dementia and what it means to families as well. So yeah, I think any improvements and any changes will be welcomed, won't they? And I think that, you know, there's a lot of challenges, and we've seen a lot of challenges, but we've always found kind of opportunities from them as well. So yeah, I've seen pockets of sort of areas where they've really thrived and been able to kind of embrace the difference in services. So hopefully we'll see some of that going forward as well.
Yeah, and when we think of some of those really diverse groups that we've got in our society living with dementia, I'm really worried about how some of those groups access services, you know, whether even access GP services and health services. So how do we afford them the access to specialist nurses and specialist dementia knowledge that they need, because they live with dementia too. You know, it's you know, and I think we definitely have to do something about building a more inclusive approach to dementia care.
Yeah, definitely. I don't think anyone's going to disagree with you on that, Paul.
Oh, well, I hope not.
Thank you ever so much. That's been really useful.
Great. Lovely to talk to you.
You
Take
too.
care. Bye.
Okay.